Our lasting impression of Wuhan is of the dedication of the workers there. Not only the epidemiologists and the laboratory scientists who had been involved in the identification of the cases, the cluster, and in defining the response, but also the dedication and the cautious optimism of the clinicians that were processing people who had fever, and were doing this in large quantity. We visited Zhongnan Hospital, and in the 2 weeks before we visited, they had processed 2,000 people to identify out of them 13 confirmed cases. So we must admire the dedication of the workers and respect the sacrifice of Wuhan and other cities that have gone into this sort of social distancing exercise in order to try and interrupt transmission. We understand, as from the evidence point of view, that social distancing, reducing as much as possible the numbers of contacts between people, is an extremely promising way of controlling and breaking the transmission. It remains to be seen how effective that has. It is safe to say that this will, to a high degree of probability, have reduced the peak of the epidemic. It will mean that eventually the numbers that could have happened without such measures would have been far higher than the numbers that we actually will be seeing when the story is told and when the epidemic ends.
But what
Pros
about
and cons?
Pros and cons, please go ahead, sir.
Whenever you do a dramatic public health intervention such as this, one always has to balance the personal freedoms versus the public health imperative. When you do surveillance, you have to look into people's data to understand who they are and what type of disease. Normally, this is data that people hold confidential, but it must be shared between the workers in order to be able to analyze the patterns. People's freedom of movement, people's ability to function and work in society are curtailed. And so against that and the economic impacts that will result, one then balances the public health greater good. One of the things that we can see is that the actions taken in Wuhan and in China as a whole have been recognized by WHO as having contributed to the protection of global health. We are seeing cases outside China, but it is safe to say that without the measures that have been taken, both locally as well as nationally, we would have seen a much larger spread.